why. And we do see this very commonly. When you do arthroscopy for just a washout procedure, and as Anton said, it's not a cure by any means, you're just sort of washing out the debris and the inflammation. We've had a significant number of patients come back or come and see us because it actually made their symptoms worse, much worse. And there's some kind of, and I don't think anyone understands the full effect, but there's some kind of rebound effect that it just makes it feel much worse, more swollen, and they tend to come to need surgery quicker than some of the other patients themselves. So in general, orthopedists, right now, the literature, and there's actually just an article in the New England Journal of Medicine this week about knee arthroscopy in the face of arthritis, and it's not advised. The benefits of, if you have true bone-on-bone now, and you have to remember arthritis has a spectrum, if it's true bone-on-bone, the injections give you as good or possibly better relief than knee arthroscopy. So keep that in mind when you go in. But you have to be very sure of your diagnosis, because there's a whole spectrum of knee problems that do get benefits from knee arthroscopy.
But again, we talked about before, every joint is different. It's a knee. I would not recommend to do arthroscopy for arthritis, but if you take a patient Dr. DeJoy was describing in the beginning, just a little bit of a groin pain, it's probably a reason to do the MRI. Hips are very different, and if you really have something torn, when the patient really benefits from arthroscopy, let's say on a hip, and fixing something at early stage, then let it go on arthritis. So it's a very complex problem.
No, it is. And again, that's important. When you talk about seeing doctors and getting opinions, you should go to doctors that sort of understand the whole spectrum of the treatments as well. And we're running out of time, but one of the things I'd like to finish up with is with LaDonna. One of the things we always talk about is patients' anxieties and fears as they go through. And so going into your first knee replacement and then your second knee replacement, what would you say were your biggest fears and anxieties each time? And were they different each time?
Well, the first surgery was just the fear of the unknown. I tell people it's sort of like the second one is sort of like bringing your second baby home from the hospital. You think, I can do this. But seriously, the first time you just don't know what it's like, so you don't know what to expect, and you don't know if you're up to the task. But the second time you've been through it and you think, I can do this. So by the second time, I was really looking forward to doing it. But I was glad that Dr. DeJoy didn't do the two surgeries at the same time when I saw him, because I had vacillated when I came. I said, I can't decide if I should have both of them done at the same time or not. He said, don't worry about that because it's not an option. I don't do that anymore. And I think it would have been hard for me to have handled the rehabilitation for two at the same time. But by the same token, the 6 months later, I was very much ready to have my second one. I don't remember any apprehension about the second one.
Well, a couple things. First of all, I'd like to thank all of our speakers for coming in and spend their Saturday morning with us. We appreciate it, as always. Very good. And also, I'd like to thank everyone again for giving up your Saturday and coming in. And as you saw, this is very interactive, so your questions drive a lot of what we want to do. Please remember to fill out your surveys and your questionnaires and drop them off on the way out, because we do look at all that. I'm sorry we didn't get to all your questions, but we do put all your questions into our database so that we try to keep those questions going. We have, I think, about 300 questions now in our database come from these sessions and all. So please, I appreciate you being involved with that. And as I said, we're keeping the exhibits open out here so you can see some of the wares and all. And there will be a tour up on 4100, which is the orthopedic wellness unit that we talked about, if you want to take a little walk. It's not real long. And again, thank you, and keep in mind for our upcoming sessions in Cranberry and then back here in February. Have a good weekend.